So in setting up an IV, one of the things you got to make sure that you have is to get the equipment together. One of our first things we'll take a look at is a drip set. Now this drip set is something that you can definitely take a look at here. It has a marking here that indicates that there is 60 drops, which means that this takes 60 drops to equal 1 milliliter. This one, on the other hand, has 10 on it. And with the number 10, it is telling us that we have 10 milliliter or 10 drops to equal 1 milliliter. The difference between these two is going to be the number of drops that it takes to equal that 1 milliliter. So in most of our patients, you end up finding out that we use the 10 milliliter, or the 10 or the 15. There's another one that also may be at a 15. And this one here, or the 60, is going to be identified primarily for medication administration that we may be utilizing as being manual. Okay? So there's our drip set. The other thing we need to take a look at is to make sure that we have our IV fluid. And right up here on the top is going to be our expiration date as well as our lot number. And just for the simplicity's sake of this one is already expired. But you can see here that there is an expiration date on there, and we're going to take a look at things we need to be aware of for that. Some other things that you may need to find out is that oftentimes paramedics or the ALS providers are going to put in what may be referred to as a lock. They may put in a saline lock. And this is just an example of what a saline lock would essentially look like. This is going to just be like a piece of IV tubing, and it will actually oftentimes just say something like an extension line. And with that, we need to also then make sure that we have some type of saline. This would end up flushing that out so that all the air is going to be out of it as well. And it too also has an expiration date that you may need to take a look at. Okay? We don't want to put anything inside of anybody that is going to have an expiration date on it. You also will need to make sure that you have some readily available IV angiocaths, and they come in different brands or different types. But the way that they all work, and there's only two that I have right here, this is an 18 or a 20 gauge, and the smaller the number, that means that, the larger the number, that means that the smaller that diameter is going to be. So most of the time in the out-of-hospital setting, an 18 is most likely used, but they also may utilize a 20. Now when we get into some traumas or cardiac arrests, other things that may occur is they may be utilizing intraosseous needles, we may be utilizing 16 gauge angios, or we may be utilizing a 14 gauge angio as well. Just depends on the patient, but for the most part you're looking at something like an 18 or 20, most likely is probably what you're going to end up at least having readily available. You will also notice that these are already in a sealed pack, and they too have expiration dates, so you need to make sure that you check those. And you want to keep them inside the pack. Don't just open it up because you're anticipating the paramedic is going to need a particular size. They'll tell you basically which size they want to use. If in fact they are also drawing up labs, they may have some tubes that you may need to have. And in this case, we're just pulling these out. Everybody has something just a little bit different, but you will notice that this here is the hub. And with that hub means that I'm going to need to also utilize this end so that it will attach here. I'm going to break this seal. I'll attach it on here. And again, I'm just getting this stuff together right now. And this will plug into the back of the IV that the provider just took care of. Some other things that you will notice is that we almost have a rainbow color of tubes. So we're utilizing different colors for different reasons. This one here is going to be dealing with anything that may be an anticoagulatory thing. This has a little, it's called EDTA, that's going to go in. They may utilize this for complete blood counts. This one here can be utilized for checking blood sugars, maybe checking for other type of electrolyte imbalances. And the red one is usually used as a spare because it doesn't have anything in it. But again, it's going to be very dependable because if it requires one of these two, this one's going to be a little bit different. Okay, so you will have to check at your own local ambulance service or at your local emergency room to see exactly which ones they're using and what order in which they would like you to go in. The other things that you need to make sure that you have are going to be an alcohol wipe. We need to make sure that we're cleaning off that IV site. We're also going to use a 2x2 or a piece of gauze pad, and then we need something to make sure that we can secure that down. And this is nothing more than a transparent dressing so that we can see what the IV site is taking a look at or looking like. Okay, so let's take a look at these things and put them all together.